The first question that comes in, this is really for everybody on the panel, so feel free to jump in. But would telemedicine be a potential way to reach patients as part of a solution to expanding access? David, let's start with you.
Sure. So I think that before we got started, Karen, Philip, you and I were having this very conversation about the role of telemedicine. I think that telemedicine is a very effective medium and instrument to reach regions of America where the access to a medical health provider in the conventional sense of the medicalized institutional medicine, where that availability is not available. But I think in Karen and my experience, since and of course, Philip, you and Elliott in your teaching and work as well, you'll see that there is an element that is subtracted in the interface with subjects in our interaction, in that we are created in the image of God and the likeness of God, and that we are a community who believes in the reality of Jesus Christ and the reality in this world. That when we sit in a room and we talk to a computer, we know we're talking to a computer. It's not a human being that's in front of us. There is an element where we know that there is someone on the other side of the screen that does care for us, or that does want goodness for us. And intellectually, we can interface with that. But again, we are not a dualism. We are a reality, a composite reality, as Elliott said so eloquently. We want to have that corporeal presence with someone else. So I would say that telemedicine is a good backup plan. It's not the mainstay, in my opinion, in terms of reaching those who are out in the community. And I think having access to a spiritual director or a support group, as Karen so well articulated, would actually be the first go-to. Thank you.
Karen or Elliott, do you have anything to add to that?
I will. I've been teaching at a nursing college through the pandemic, and what David said is absolutely true. You absolutely lose something when you're communicating back and forth across a computer screen. Faith community nursing is so relational that you want to be with that person. I think telemedicine is a great backup for those places in the country where it's 100 miles to the nearest provider. For those times, like the past 2 years when we've been in a pandemic and could not be physically close to people. But I think it's a substitute. It's not the best option.
I would agree that in a circumscribed manner, it can be very effective. For instance, we have critical access hospitals that are not going to be able to employ a full-time psychiatrist, but you get patients in the emergency room who have a psychiatric issue that needs to be dealt with in a relatively short manner. That's a very effective way of utilizing telepsych. But I think that if we don't let it, creep beyond its those kind of like ideal effectiveness pieces and say, well, this is the end all be all solution. I very much agree with the relationality, the incarnationality of being present with people. And it also means that what level of intervention are we talking about? So if it's just talking with somebody, like I said, with David, where it's just a session, or is it that, I've got somebody in acute distress and we need some sort of intervention and guidance? Those things should be taken into account as we're starting to think about the use of the telemedicine there. So I'm very supportive of it used in an appropriate and circumscribed way.
Excellent. Thank you so much. Our next question, and again, this is one that anybody can jump in at. I think we'll start with Elliott, though, because Working with bishops and conferences is right up his alley. Are there any recommendations on what bishops and or state level Catholic conferences can do to support or encourage the solutions proposed today?
Absolutely. I think that, well, again, just using this as a springboard to say this is a profound issue that affects every community that we have in, our local churches. For the bishop to be the leader of that conversation and say that we have a special responsibility to have these conversations, help destigmatize, increase resources and training at the parish level, at the diocesan level. So in that sense, they can really lead by example, I think, in terms of things like the suicide, the QRP training, for instance, of why don't we have this for all of our diocesan staff, for instance. Could be a conversation like that. I think that helping, encourage, encourage like local pastors, for instance, they're already dealing with addiction or mental health issues on some level at every parish. I think that that's just the reality. Karen, tell me that I'm wrong there, but I think that that's part of what it means to be, a parish priest. But I think a more formalized, organized discussion to help address questions like David's raising around how do we respond in a coordinated manner as a church that's not exclusively dependent upon the health system would be a fantastic place to start. And whether that comes from ground up, at the parish level, up to the diocese, or if it needs to be led from the diocese and bishop's office, I think that that's a worthwhile pursuit.
Karen or David, do you have any thoughts on this aspect?
I think the only thing I would add is, David, Elliott, you're absolutely right. I keep wanting to call David. Elliott, you're absolutely right that every parish priest is dealing with it. And I think sometimes they may not know it. One of the mothers who is part of the family healing ministry shared with me one time that she always arrived to church just a couple minutes late, and she would leave just a couple minutes early so that she didn't have to talk to anyone. She didn't have to have anybody ask her, how are your kids doing? And have to either tell them how her kid was doing or come up with some other answer. She just was able to escape. So I think, when we see those people coming late, leaving early, I think we need to be mindful of that. And that's just I just wanted to bring that, every parish priest is dealing with it, whether they're aware of it or not.
Yeah, I think that a lot of the transformational implementation will have to occur at a conversation level with the USCCB or with the episcopate, where they know that larger numbers of spiritual directors are needed, which the Pope has said already, which needs to occur and needs to be trained and to be spread out. If you imagine every Catholic school having a spiritual director who is directly working with the chair of the theology department, how powerful that combination would be in a school for all the growing young people that are in that school. I think that idea has to come from the bishops. Yes.
We have received a question that kind of dovetails off a little bit of this discussion. How do professionals work with pastors to get them comfortable with having, some kind of support or formal mental health system at the parish level? Especially, for pastors who, might not be inclined to do this kind of thing.
Yeah, so I'll first open this topic. So I collaborate with a lot of the priests who are in deliverance ministry or in the healing ministry in the Archdiocese of Washington. And I think that at the end of the day, them knowing and trusting that a Catholic psychiatrist understand their role, that we are instrumental in the work of Christ in the community, and that we know how to work as a team member and to be able to at times really take a back seat and to follow the lead of the pastor and those who are the spiritual directors or the priests who are doing the deliverance ministry. That actually matters a lot for them to know that, because too often they run into providers, mental health providers, whom take over and then ignore the importance at the local level, at the community level, at the family level, in terms of individual sharings with their pastor about how their family situation is going. So I think that's one of the key pieces, is the ability for the pastors to know that the mental health provider professional is able to set up proper boundaries and to not overstep.
Elliott or Karen, do you have anything to add in on that?
I just add one piece, and that's based on kind of my own experience, is that they not only do they want to trust boundaries, but you call it integrity of the content that's going to be. Are they going to be getting a message that is consistent in faith, aligned with the faith, so that I can trust basically handing off, my parishioner to this service, is another component of where the opportunity would lie to build up kind of better trust, is to make sure that, and that's where I go back to my point around where appropriate, developing a positive set of treatment alternatives that's, explicitly or maybe implicitly, but just aligned with the faith, such that it's not like you're putting them out into a system that you don't necessarily trust. And I think that's an issue that can be addressed.
Excellent. Thank you very much. We've had a couple questions on this topic. Karen, I think that you might be the best person to answer this, but what are the existing programs out there for either mental health support or training in this, with this Catholic understanding, for addressing mental health from a Catholic perspective? And, are any of these programs, say, in a seminary or being done for priests, et cetera, kind of talking about David's proposal there?
That's a great question. I can't answer what's going on in the seminaries, but what I can tell you from
I text you because
from the faith community nursing
I still
perspective,
see
the faith community nursing education is not strictly Catholic based. It's really for any and all faith traditions. I would lean toward looking at the Catholic Nurses Association, Catholic Nurse Foundation, and see what their suggestions would be. So I don't really have an answer to that great question.
All right, thank you very much, Karen. Does anybody else, Elliott or David, are you aware of any more information on that issue?
No, just one thought there. In terms of talking to my psychiatrist here, he said a lot of it is very local, that we need, instead of big national programs, focusing on resources available in your community is the information. If there's a core set of information that you need to be able to have to make sure that people are aware, that is where to focus, is getting to know the people in your community, the resources in your community, to be able to kind of help break down those barriers for access. That's a point that was emphasized to me as making sure that we really do understand that as a parish community, as a Catholic community, and the more that we can help grow those local resources, then the more better, or so much the better that we'll be.
Excellent. I think we have time for one more question, and this is another one that I think that all of you have touched on to some extent through your in your presentations. But the question is to what extent are the anthropologies of the church and psychiatry commensurable? and what are the main points of tension and how do we resolve them? And kind of following up with that, are there, any magisterial documents that address mental health or that would be particularly useful for getting an idea of the, perspective on mental health from Catholic anthropology?
Yeah, Philip. So I'm going to probably eventually lead back to Karen and Elliott because I think Elliott already spoke quite a bit on this topic. But just to complement that, what has already been said, in the writings of St. Thomas Aquinas, there's actually a very well laid out anthropology, which actually have been further augmented by the work of Divine Mercy University, formerly known as the Institute for Psychological Sciences, on that topic to kind of adapt it to this, most 21st century understanding of mental health issues. What I think is the potential confusion that has been introduced in more of the mainstream talk really stems from this kind of Enlightenment liberalism, kind of post-Cartesian dualism understanding of this mind that is separated from the person, which when you separate out the mind from the person as a separate thing, you have this potential pocket where you could create all kinds of contradictory notions upon notions within itself that actually doesn't really help us to fully understand. So if you really want to go back to a very clear reality and understanding of the human person, St. Thomas Aquinas lays it out very beautifully, and subsequent magisterial teaching as well as research institutes like Divine Mercy University have been able to fill out that space. I think the DSM and also a lot of the evidence-based work is really research-based. It's really manuals that were developed for empirical research at the high, like the university or NIH level, where they're looking at various different type of features to a condition and seeing what are the coherent parts that are tying together. That really doesn't have much bearing to the totality and the reality of a person.
So I will agree with David. Anytime you can go back to Thomas is a solid move. And again, he really does have a well-structured articulation of the human person, its orientation, its goals. And that's where I was kind of referencing earlier. I remember having a conversation with, actually it was a extended family member who was going to be a clinical psychologist, just training. So it's a conversation with the student, so take it with a grain of salt. But I said, okay, well, that's an interesting field. How do you define something as a disorder? And he said, well, if the patient's unhappy with it or if society thinks that it's a problem. And I said, well, what if the patient's not unhappy with it and then society doesn't say it's a disorder? Well, then it's not a disorder. Well, I said, well, that seems to be, very much on a subjectivism basis, going back to the Cartesian kind of piece that David's talking about. Of like, my mind says this is okay, right? I'm not connected or grounded to some objective reality, and that's where I see a potential advantage for a Catholic system that's understands kind of like how the human being is appropriately ordered and its drives, and from a natural law standpoint, what's authentically good and fulfilling for a human person. You're going to find that there in Aquinas, and then that's a basis to understand what not only is a disorder, but what's properly ordered and how to move from one to the other, is at least some starting point. And then also from the integration of, in psychiatry, to be able to use medications as a means to be able to help address mental health concerns. By appreciating that human beings are this nexus of body and soul, you're able to treat all dimensions of that person to be able to help resolve whatever, ultimately spiritual issue it is, or it's impacting their spiritual health. Because you can use medications, you can use the discussions and kind of counseling, and it's all part of the same package, right? And I think that that's just a beautiful way to be able to appreciate the complexity of human beings and give you a solid basis to start from, trying to help them. And I go back to this. It's so important because more than any other kind of field, this field impacts the ability of patients to make decisions. And how do you get to heaven but making decisions? So ultimately, at the center of this ministry is a concern for the salvation of souls. Health, yes, we want to operate them. We want them to operate well in society and be able to live fulfilling lives here. But ultimately, it's about the eternal goals. And here, by appropriately understanding the subject matter that we're dealing with, we're able to actually have that in mind and help them pursue that.
Karen, you got any thoughts on this to bring the webinar to a close?
No, I think the two gentlemen did a wonderful job explaining their answers. I just think we need to remember that we are dealing with a whole person and really need to focus on that idea of whole person.
All right, well, thank you very much for attending this webinar on mental health and mental disorders. Thank you very much to our three guests for sharing your perspectives on this. You will be able to find this webinar, some of the materials that the presenters gave, and additional resources on mental health and other bioethical topics at the NCBC site, www.ncbcenter.org. And again, thank you very much, everybody who attended, and have a wonderful day.